The National Pediatric Agenda for Research.
Family-centered care.
Increasing the workforce in all levels of nursing.
Interdisciplinary cooperation.
Emergency departments.
Core competencies.
Children's dental health.
The parent-nurse partnership.
Changing the way that we think about education.
We're the voice of children.
The Pediatric Nursing Certification Board has had a long-standing interest in the well-being and health of children and their families, and how we can support this through the contributions of pediatric nursing. Experts in education, research, administration, a lot of areas of pediatric nursing. Some of the subspecialties, such as school nursing, community, people from primary care, tertiary care settings, all came together and identified what the urgent issues are, formulated a plan as to how to address some of these issues, and also agreed on a collaborative platform.
I was very privileged to facilitate this first annual Pediatric Nursing Invitational Forum hosted by the Pediatric Nursing Certification Board. It brought together the best thinking of pediatric experts. We used a strategic learning process to reach our desired outcomes, and this process involved learning what was going on in the environment, focusing that learning on primary issues, aligning those issues with appropriate actions, and then determining what our execution or next steps would be. Through small and large group discussion, the participants identified 5 themes that were important to address in terms of pediatric healthcare and pediatric nursing's contributions to that. These 5 areas are access, education, care coordination, advocacy, quality, safety, and evidence-based practice.
Who will see the child tomorrow? The school nurse. The point of access, that's what we need to get to.
The first theme was access. And access focused on the ability of children and their families to be able to receive care from appropriate providers who have the expertise and the knowledge necessary to care for children and their families.
What we want to be able to do is say to legislators, healthy children learn. And to get healthy children, we need health services. We need school nurses, school-based clinics, pediatrician consultants, speech and language. We need to address the issues of health care at the point of access for children, which is in schools. If we're going to develop qualified pediatric nurses, we need to be able to be educating them, funding them for education, funding them for evidence-based practice and research. If we do nothing else from this meeting, we need to think about the fact that if we're going to have access for children to have pediatric care, we need to go upstream. We need to look at education. We need to look at research. We need to get those kinds of things out there. And our colleagues in geriatrics have done this. They have the Hartford Center. They have huge funding.
We also talked about focusing on ways to change the mindset about the importance of maintaining your professional practice and maintaining that lifelong learning.
The second theme was education. And in this theme, the group focused most of their strategies around developing curriculum standards that would include comprehensive pediatric nursing content for all graduates, so that nurses that complete basic nursing programs would have beginning expertise and competence in caring for children and their families. Success would be some national consensus-based standards for pediatric required by all undergraduate program. I love this one.
I'm definitely intrigued by this national consensus-based standards of or being able to predict that every basic RN student, as they enter a curriculum to prepare them to be registered nurses, that we would have a predictable understanding of what their level of knowledge would be about pediatrics at time of graduation, because I don't think that exists.
This is urgent. We need to develop those pediatric standards that all nurses must graduate with.
Graduates that have basic pediatric competencies and skills and a mechanism for maintaining it, and that regulatory agencies actually give recognition and require validation.
Our success measure was that there would be a pediatric nurse wherever children are.
The third theme was around advocacy and the need for pediatric nurses to be engaged with other advocacy groups, as well as to create synergies between themselves and the families to promote pediatric nursing's contributions to their health.
There would be key pediatric nurses in each state that would be the point person for parents who wanted to advocate for whatever issue that they were interested in. Our third success measure was development of a network of pediatric nurses that can bring together the science and information and advocacy tools for family-centered care.
Safe care is quality care.
The fourth theme was quality, safety, and evidence-based practice. The focus of this particular theme area involved actions and recommendations around wellness and achieving wellness through the provision of expert pediatric care wherever a child was encountered and required care.
I think we were struck by the statistic that really the majority of pediatric care is not provided in pediatric centers. So that, again, safe care requires that people know how to take care of pediatric patients. Many organizations are trying to answer that same question. So how can we collaborate and come up with a national standard based on evidence, instead of everybody working individually and potentially having different standards?
We know that we will have success if there is safe care of children and adolescents across all settings provided by practitioners with expertise in pediatrics. Are we hearing a common theme here?
We can have a united pediatric nursing focus and voice on what we believe a healthcare home is.
Care coordination was the fifth theme, and it focused on the need of pediatric nurses to be knowledgeable about their role in the pediatric healthcare home and their role in care coordination.
We wanted to achieve some consensus on the definition of healthcare home and care coordination in pediatrics.
To develop a registry of pediatric experts so that there is some central repository. Each professional nursing organization can identify who their experts are, but then we would have this wonderful brain trust, so to speak, of experts that we could call upon for state, local, and national initiatives. We have to connect those dots, and until we do that, we would not achieve seamless communication. This is the bigger picture. This is where we need to be, and then we need to filter that down to everyone that cares for children, recognizing that that is a challenge to make that happen.
We developed an advisory group who is going to continue on with looking at how we can move forward with a united voice, bringing together and all of these experts in pediatric nursing to move this agenda forward to really strengthen healthcare of children and their families.